The most superior part of the stomach is the dash. A. Fundus. B. Rugae. C. Body. D. Pile or cantrum. The answer is A. Fundus. The areas of the stomach, from superior to inferior, are the fundus, the body, and the pile or cantrum. The rugae are folds in the stomach that increase its surface area and expandability. What ligament attaches the liver to the abdominal wall? A. The falciform ligament. B. Ligamentum flava. C. The ligament of Treitz. D. The splenorenal ligament. The answer is A. The falciform ligament. The ligament of Treitz suspends the duodenum, while the splenorenal ligament goes between the left kidney and the spleen. Ligamentum flava are ligaments present in the spinal cord. Which of the following digestive enzymes breaks down starches? A. Lipase. B. Amylase. C. Protease. D. Peptidase. The answer is B. Amylase. Amylase enzymes, produced by the salivary gland and the pancreas, break starch down into simple sugars. Peptidase and protease enzymes break down proteins, while lipase enzymes break down lipids. Which of the following substances helps emulsify fats during digestion? A. Hydrochloric acid. B. Cholecystokinin. C. Bile acids. D. Pancreatic lipase. The answer is C. Bile acids. Bile acids, produced in the liver and stored in the gallbladder, help emulsify fats during digestion. The process of emulsification makes fats collect into small droplets, increasing the surface area of ingested lipids and increasing the ability of pancreatic lipase to break fats down into fatty acids and glycerol. Hydrochloric acid aids in the breakdown of proteins in the stomach, and cholecystokinin is a hormone with a wide variety of functions in the digestive process, including the stimulation of the release of bile, though it does itself not play a role in emulsification of fats. Which of the following would be a normal gastric pH? A. 4.0. B. 1.2. C. 4.8. D. 2.0. The answer is D. 2.0. Normal gastric pH ranges from 1.5 to 3.5. This highly acidic environment aids the stomach in denaturing proteins, a fundamental part of digestion. Where does lipid digestion begin? A. The jejunum. B. The duodenum. C. The ileum. D. The stomach. The answer is B. The duodenum. While a small amount of fat digestion may occur in the mouth via the action of lingual lipase, the majority of lipid digestions begins in the duodenum. The presence of fat in the small intestine triggers release of pancreatic lipase, which enters the duodenum via the pancreatic duct. Fat digestion does not occur in the stomach. Which of the following structures controls the release of pancreatic enzymes and bile into the duodenum? A. The ileocecal valve. B. The sphincter of Oddi. C. The pyloric sphincter. D. The ampulla of Vater. The answer is B. The sphincter of Oddi. The pancreatic duct and common bile duct come together at the ampulla of Vater, allowing for the combination of pancreatic enzymes and bile. This combination is released into the duodenum via the relaxation of the sphincter of Oddi, a muscular ring at the end of the ampulla. The sphincter of Oddi also prevents any backflow of duodenal contents into the ampulla. The pyloric sphincter controls flow of chyme between the stomach and the duodenum, while the ileocecal valve separates the small and large intestine. Lipids are transported out of the digestive tract via what system? A. The circulatory system. B. The lymphatic system. C. The hepatic system. D. The excretory system. The answer is B. The lymphatic system. Lipids are transported out of the digestive system via lacteals, lymphatic capillaries within the villi of the small intestine that absorb fatty acids in the form of chylomicrons. They are then transported through the lymphatic system and re-enter the bloodstream via the thoracic duct. The hepatic system produces bile, a vital part of lipid digestion, but it does not absorb lipids. Nor does the excretory system, which is not really a single system but rather a collection of organ systems including the kidney, skin, liver, and colon. Where is gastrin produced? A. Beta-islet cells of the pancreas. B. Parietal cells of the stomach. C. Chief cells of the stomach. D. G cells of the stomach. The answer is D. G cells of the stomach. Gastrin is produced by the G cells of the stomach. Parietal cells of the stomach secrete hydrochloric acid, while chief cells secrete pepsinogen and chymosin. Beta-islet cells of the pancreas produce glucagon. The hydrolysis of oligosaccharides into disaccharides occurs in what part of the digestive tract? A. The duodenum. B. The stomach. C. The ileum. D. The jejunum. The answer is A. The duodenum. The hydrolysis of oligosaccharides into disaccharides occurs in the duodenum, after the addition of pancreatic amylase from the pancreatic duct. What is the function of gastrin in the digestive tract? A. Increases gallbladder emptying. B. Triggers chief cells to secrete pepsinogen. C. Triggers parietal cells to release HCl. D. All of these are true. The answer is D. All of these are true. Gastrin, a peptide hormone released by G cells of the stomach, has many functions in digestion. It triggers parietal cells to release HCl, it increases gastric motility, it triggers chief cells to secrete pepsinogen, and it stimulates the gallbladder to release bile. Which of the following is not a brush border enzyme? A. Sucrase. B. Lactase. C. Carboxypeptidase. D. All of these are brush border enzymes. The answer is D. All of these are brush border enzymes. The intestinal brush border is the microvilli covered surface of the small intestine. It is where a large part of the digestive process occurs, aided by brush border enzymes such as sucrase, maltase, lactase, and carboxypeptidase. Which of the following is not an enzyme secreted by the pancreas? A. Amylase. B. Insulin. C. Lipase. D. Carboxypeptidase. The answer is B. Insulin. Insulin, while secreted by the pancreas, is not an enzyme. Rather, it is a peptide hormone that plays a role in lipid and blood sugar metabolism. The other enzymes listed are all pancreatic enzymes that play a role in digestion. Amylase breaks down carbohydrates, while lipase and sterolesterase break down fats. Carboxypeptidase is an enzyme that removes the final amino acid group from a protein. What cells of the stomach secrete hydrochloric acid, HCl? A. Chief cells. B. Parietal cells. C. M cells. D. Foveolar cells. The answer is B. Parietal cells. HCl is secreted by parietal cells of the stomach. Chief and foveolar cells of the stomach secrete pepsinogen and mucus respectively, and M cells are not stomach cells, but rather intestinal cells involved in mucosa-associated lymphoid tissues, or mold. Mastication and peristalsis are examples of what type of digestion? A. Physical. B. Chemical. C. Mechanical. D. Oral. The answer is C. Mechanical. The two main forms of digestion and chemical and mechanical. Mechanical digestion involves the physical crushing, mixing, and breaking down of food particles into small pieces or slurries. Mechanical digestion primarily occurs with mastication and is carried out to some degree by peristaltic contractions of the stomach and intestine. Chemical digestion is the further breakdown of food particles into their molecular parts. This is carried out primarily via enzymes, HCl, and bile. What is a normal transit time for the stomach? A. 10 to 12 hours. B. 10 minutes to 4 hours. C. 5 to 10 minutes. D. 2 to 6 hours. The answer is B. 10 minutes to 4 hours. Stomach transit time varies widely. It can take anywhere from 10 minutes to 4 hours for food to pass through the pyloric sphincter into the duodenum. Transit time in the stomach is affected by the composition of the meal, and by the individual's rate of gastric emptying. Transit time may be shortened due to consumption of liquid or simple carbohydrate foods, or lengthened in the case of consumption of solid food that has a high protein or fiber content. What is the normal transit time of food through the small intestine? A. 3 to 8 hours. B. 8 to 12 hours. C. 12 to 18 hours. D. 1 to 2 hours. The answer is A. 3–8 hours. Normal transit time of food through the small intestine is 3 to 8 hours. This is significantly longer than transit time through the stomach due to the wider variety of digestive processes that occur in the small intestine, including the catabolism of proteins, lipids, nucleic acids, and simple and complex carbohydrates. What is the average transit time of the colon? A. 16 to 24 hours. B. 8 to 16 hours. C. 24 to 32 hours. D. 2 to 4 hours. E. 32 to 48 hours. The answer is E. 32 to 48 hours. The average colon transit time for both adults and children is between 32 and 48 hours. This is significantly longer than the transit times of food through the stomach and small intestine, which averages 4 to 12 hours total. A slow transit time through the colon can be increased by various lifestyle factors such as exercise and hydration, and dietary changes such as an increase in fiber-rich foods and avoidance of food allergies or other constipation triggers. Which of the following structures is the main blood supply to the small intestine? A. Inferior mesenteric. B. Superior mesenteric. C. Right hepatic. D. Left gastric. The answer is B. Superior mesenteric. The main artery supplying blood to the small intestine is the superior mesenteric artery. This vessel branches off the abdominal aorta and supplies the lower part of the duodenum, the ileum, the jejunum, and 2/3 of the transverse colon. The rest of the colon and the rectum are supplied by the inferior mesenteric artery, while the right hepatic and left gastric supply the liver and stomach, respectively. All of the following are salivary glands except A. Submandibular gland. B. Parotid gland. C. Sublingual gland. D. Thymus gland. The answer is B. Thymus gland. We have three main types of salivary glands: the parotid glands, the submandibular glands, and the sublingual glands. The thymus gland is not a salivary gland, and is located in the chest just superior to the heart. Which of the following is the main signaling molecule that acts on salivary acinar cells to increase production of saliva? A. Acetylcholine. B. Epinephrine. C. Dopamine. D. Serotonin. The answer is A. Acetylcholine. The primary signaling molecule that acts to increase saliva production by acinar cells in salivary glands is acetylcholine. Acetylcholine is released by parasympathetic innervation and triggers muscarinic receptors in salivary cells, leading to increased saliva secretion. While serotonin, epinephrine, and dopamine may have some effect on salivation, they are not the primary molecules through which the process is controlled. In what part of the brain is the swallowing center located? A. The medulla. B. The cerebellum. C. The thalamus. D. The cingulate gyrus. The answer is A. The medulla. The swallowing center is not a specific anatomical structure, rather an area of physiological control. The swallowing reflex is primarily controlled by the medulla, and to a lesser degree by the pons. None of the other structures listed play a significant role in deglutition. Which of the following molecules is necessary for absorption of vitamin B12? A. Intrinsic factor. B. Norepinephrine. C. Serotonin. D. Sodium. The answer is A. Intrinsic factor. Dietary vitamin B12 must first form a complex with intrinsic factor, a gastric glycoprotein, before it can be absorbed into the hepatic portal system. Individuals who are unable to produce intrinsic factor are at risk for developing B12-related macrocytic anemia. While the other molecules listed are necessary for a wide variety of digestive and nervous system function, they do not directly control vitamin B12 absorption. Which of the following enzymes breaks down triglycerides in chylomicrons and very low-density lipoproteins, VLDL? A. Hepatic lipase. B. Lipoprotein lipase. C. Colipase. D. Lingual lipase. The answer is B. Lipoprotein lipase. Lipoprotein lipase hydrolyzes triglycerides into 2 free fatty acids and 1 molecule of monoacylglycerol. Hepatic lipase aids in the regeneration of LDL. Colipase is secreted by the pancreas and is an important coenzyme for optimal function of pancreatic lipase. Lingual lipase is a fat-digesting enzyme that is secreted in the saliva and aids in the breakdown of dietary lipids before they are stored in chylomicron form. All of the following large intestine bacteria are considered beneficial except A. Lactobacillus plantarum. B. Streptococcus thermophilus. C. Lactobacillus acidophilus. D. Clostridium difficile. The answer is D. Clostridium difficile. All of the bacterial strains listed have been shown to have beneficial effects on gut and immune health except for Clostridium difficile, a pathogenic bacteria commonly seen in hospital settings after prolonged antibiotic use. Clostridium difficile has been associated with chronic diarrhea, behavioral disorders, and colitis.